Hi, this is Jason Kilmer from the University of Washington, representing Washington's Young Adult Health Survey with a video on where and how young adults access cannabis in Washington. The Young Adult Health Survey is funded by the Healthcare Authority's Division of Behavioral Health and Recovery, and it's an annual survey since 2014 of 18 to 25-year-olds, young adults, in Washington state. The sample is recruited using a combination of invitations through direct mail to a random sample from the Department of Licensing, as well as advertisements on social media platforms. It's a completely confidential survey that's been in place for 10 years. Now, we collected data in 2014 and got as much of it as we could before the first cannabis retail store opened. That allowed us to have a pre-implementation of legalization, a pre-implementation of Initiative 502 time point, so that every year afterwards, we could look at trends, how things have changed, and so on. There's a lot going on this slide, but once you know what you're looking at, it's pretty easy to understand. You see the sources because we asked people, have you used cannabis in the past 30 days? And when they said yes, we asked them, where do you get it? Check all that apply. All the sources are going up and down on the left. And as you go left to right, it's all the different cohorts. Everything you see in yellow is going down significantly over time. The one thing you see in blue is going up over time. You can see that most sources are either holding steady or going down, but the one source that has certainly increased among those with legal access is buying it from a retail store. That's by far the number one source of cannabis for 21 to 25-year-olds, though other sources do still exist. Among 18, 19, and 20-year-olds, it's a little more varied. Everything you see in yellow is going down over time. Everything you see in blue is increasing. We see a significant decreasing trend in getting it from friends, getting it from someone with a medical card, getting it at a party, and getting it some other way. Where we see it increasing is giving money to someone to get it for them, getting it from their parents or guardians with that parent or guardian's permission, or stealing it from a store or dispensary. I'll draw your attention to the getting it from parents or guardians with their permission. If you look on the far right, this number is now up to 15.77%, almost triple what it was in 2014, and it's now the number 3 source of cannabis for 18, 19, and 20-year-olds, behind getting it from friends and giving money to someone to get it for them. Why is that so noteworthy? Lots of research shows that perceived permissiveness by parents and guardians about substance use is strongly associated with a young adult's actual substance use. So parents, guardians, caregivers can be our partners in prevention. And so if someone's saying, well, how can I be most useful? How can I have a conversation with a young adult about cannabis use? There are free resources in Washington that can be really, really useful. One of these is starttalkingnow.org. It's available in 38 languages, and on this website provides strategies for how to have conversations about substance use with teenagers, with young adults. There's also learnaboutcannabiswa.org/parents. Also free, and when you come here, you can get information on what increases the risk that a child, a teen, an adolescent, a young adult will use cannabis, and how a parent, caregiver, or guardian can help reduce that risk. Strategies for how to talk about a teen, a young adult, about cannabis use, and what to do if you're worried about someone that might be using. Again, these resources are free. You can do with these as you wish, but it's very clear that parents, caregivers, and guardians can be important partners in prevention as we look at how to best serve young adults in Washington state.